South Africa has made great strides in fighting the scourge of HIV. The country has the highest number of people on the highly active anti-retroviral therapy. Despite this, women bear the brunt of the HIV burden. To explore this and other issues, we joined in studio by Professor Sinead Delany-Moretlwe. She is the Director for Research at the Wits Reproductive Health and HIV Institute. Professor, appreciate you coming through to the studio, especially on a Sunday. Thank you.
It's a pleasure. Thank you for having us.
All right, so you are from the Wits Reproductive Health and HIV Institute, and this institute, I understand, one of the aims is to generate research and data to inform, I guess, policy and programs for government. What sort of cutting-edge research have you been doing there?
Well, I think the work that we have focused on that is of interest is the work that we have done really to understand why women particularly are affected by the HIV epidemic, but also some of the responses to the epidemic through the development of new technologies like pre-exposure prophylaxis that can reduce women's risk for HIV.
Right. So tell us about women and girls between the ages of 15 and 24, high risk. Why?
Yeah, what we have seen from recent surveys is about a third of new infections in people aged 15 to 49 occur in young women aged 15 to 24. And some of the main reasons for that are early age of sexual debut, having partners who are about 5 years older, inconsistent condom use, but fundamentally and then I think there are a number of social issues like gender-based violence, which increase young women's risk. And fundamentally, young women don't have control over means of HIV prevention. People who decide condom use are their male partners, and those are the things that put young women at risk. I think the other thing that we've seen from recent surveys is that it's men, particularly those who are living with HIV. About 3/4 of them, in fact, don't know their status, and so the potential for U equals U or undetectable is untransmissible is not possible if those men aren't on anti-retroviral therapy, and those are some of the things that put young women at risk.
Yeah. So why are people not checking? Is it an issue of fear? Is it an issue of discrimination, stigma, or all of the above?
I think it's probably all of the above.
Yeah.
We've made great strides with testing. About 80%, 85% of people in the country know their status, but we know that adolescents in particular experience barriers in access to healthcare. They experience stigma and discrimination. There are a lot of adult views around whether or not young people should be sexually active, and I think that it represents the biggest reason why young people are afraid to access services.
So you mentioned something very interesting, and we've been having this conversation with regards to PrEP, the pre-exposure prophylaxis, which basically is the use of this drug to prevent the virus from people who have not yet been exposed by the causing agent. How readily available or freely available is PrEP in South Africa?
So PrEP was first introduced into South Africa in about 2016, and we had a kind of incremental introduction, and that's because the health system really had to learn how to deliver PrEP. This is a new technology. We haven't, apart from condoms, we haven't really had a sort of biomedical method of HIV prevention in services. So we've seen the program introduced first to sex workers, then to men who have sex with men, and then incremental progress and expansion. And now we have a goal really through the Department of Health to see 1,000 sites that are able to deliver PrEP by the end of this year, and then sort of within a year, I think, expansion to every primary health care facility in the country. But there have been limitations in access sort of in the first few years of the program.
So what is the process in order to get onto this regime? I mean, for somebody that is sitting in a rural area, do they go to their clinic and request this? Take us through that process.
Yeah, so I think the first thing is to identify sites, and there is a website supported by the Department of Health which can provide information on where to access PrEP. But essentially, people present to a healthcare facility. The most important thing is that we assess that you're not already infected with HIV, because if you are, that's key. You need to be on, obviously, 3 drugs. And there are a couple of other tests that are done essentially to assess kidney function, to screen for other sexually transmitted infections. And then people are provided with a PrEP, which means taking a pill a day every day in order to protect themselves against HIV. Unlike anti-retroviral therapy, it's not lifetime. It's really for the period where they are going to be at risk for HIV. But there are requirements for sort of how many pills you need to have taken in order to achieve protection, and also kind of how you stop. And those are some of the things that healthcare providers will tell you.
You know, when we look at the various provinces, and as you mentioned, there's huge strides in the fight against HIV. One of the provinces is KwaZulu-Natal, and one of the districts is Ugu. That is like a shining example in terms of the 90-90-90 targets. It can be done, but the deadline, I guess, for this goal is 2020. Is it realistic?
Yes, I mean, I think the fact that we've been able to achieve it in these districts suggests that it is achievable. It's not, it's not something that can be done overnight. And what we have seen is that really it's attempts which have involved community and mass community mobilization. That's where we've seen success. I think, the challenges that we face are really to reach those populations that maybe are not able to link to care. And we've seen that those populations at the moment are men, so to increase testing and linkage to treatment in men, but also adolescents. In fact, adolescents are the population that are being left behind. While we see sort of reasonable testing rates, only 40% of those who are positive actually link to care. And so often the last 10% or the last mile is the hardest, but that's what we're going to have to do.
Yeah. All right, Professor, look, there's still so much to discuss. I want to keep you here if you can. We're going to take a quick break. It is now 9:58, and we will come back with the good professor to talk about various issues around HIV and AIDS.